Hello and welcome to the Infusion Billing Icon support video. We will be covering in depth the Infusion Billing Icon and process. At the end of this lesson, you will have a better understanding of the new icon and process, as well as why the stop time documentation is so important. You will also be reminded of the importance of signing off the begin bag each time you start a new continuous medication bag. If afterwards you continue to have any questions, please feel free to contact us using the information provided at the end of this video. So what is infusion billing? For OB patients with an observation or outpatient status, whether treated within an hour or overnight, CMS will reimburse our hospital for individual nursing actions performed during the patient's stay, such as the nurse's time taken to infuse a hydration, give an IV push, or chart a fetal non-stress test. When it comes to IV care, this means that we are required as a medical facility to show specific documentation of the times the infusions end. For example, we have to prove that hydration was infused over a certain amount of time. CMS requires documentation to be done by a nurse, the nurse who gave the care. Without that verification, we can't charge for all of your hard work. CMS defines an infusion as an IV medication that is administered longer than 15 minutes. Without documentation of a stop time, we are forced to charge these as an IV push, which is quite a bit less than an infusion charge. However, this new process is more than just about the revenue. Stop times paint a better picture of the patient's stay and care received while here. Documenting stop times is best practice and is needed to support orders and physician documentation. You will now need to chart infusion end times for IV medications given to patients in observation or outpatient status. This is done by using an icon in the MAR. The icon will only appear on medications that require a medication stop time. When the icon is present, it means the nurse needs to click on it, review the stop time that is present, make any adjustments as necessary, and click Sign. If the order was entered with a duration, example, infuse over 1 hour, then the end time auto-populates for 1 hour from when the begin bag time was documented. And if this accurately reflects patient care, you only need to confirm this by clicking the Sign button. This new process is quite simple. Chart begin bag as normal through BCMA or the MAR. This step is critically important for every bag, as missed bags mean more missed revenue. The icon will appear in the MAR only if the medication requires a stop time. When a bag is completed, in some cases you'll be hanging a new one, you're going to click the icon, review the times that appear, and click Sign. To make this even easier, we're going to show you what it looks like. orders require to give multiple doses of the same medication during a patient's stay. For example, the patient may be receiving Rocephin every 6 hours. When scheduled medications are ordered, you may find a requirement for more than one stop time to be documented. While you can sign off all multiple stop times at the same time, you should only sign the end times that you are responsible for. Check only those that apply to you and click Sign. If there are stop time requirements that occur during a time another nurse was caring for the patient, like on a shift change, you will need to uncheck those tasks. The nurse responsible will be asked to follow up and sign them. Some medications will show the same start and stop time. This results in a 0-minute infusion time. It is necessary to adjust the stop time to reflect the true infusion time of the medication. For injections, adding a minute or two will suffice. Always remember to properly document when you begin a new bag. For example, if a patient has a continuous hydration running and you change the LR bag, be sure to document the stop time for the prior bag and click Begin Bag for the new bag started. It is always appropriate to document a stop time for a medication that you did not start, as long as the infusion ended during your care, because this is what you are really verifying. Here is an example. If Nurse A started a bag of LR before her shift ended, she then gives report to Nurse B, who assumes care for the patient, and the medication stops 15 minutes later. Nurse B would simply go into the MAR and follow the procedure for documenting the stop time. Although these changes affect only observation and outpatient patients, there is no need to worry about the status of your patient. If the icon is present, simply sign it. There is no need to change the volume when signing a stop time. After completing the HealthStream education, emails are going to go out regarding icons that were missed and need to be signed off. Please complete these tasks as soon as possible, as proper billing is being delayed. Okay, so let's take a look and see how all of this works. So we are currently inside the patient chart, and we start by going down to the MAR. You'll see the medications listed here, and I'm first going to document that a medication was given. So I will go down to my Zofran and just document that I have given that medication to the patient. Now once I refresh, I'm going to see the icon appear right above the name of the medication that was documented as given. This little icon, it's supposed to be an infusion bag. It's kind of like green and rectangular. That lets you know that a medication has a need for a stop time. If you don't see it, then that means it's already been signed off, or that medication does not qualify for needing a stop time. You simply left click on the icon and you'll have a box appear. This is where you document the time that the medication has ended. You'll see the start time. That is auto-populated based on the time that you documented of giving the medication. And next to that is the end time. This will usually auto-populate with the correct duration time. So if you have given a medication that has a set rate for the medication to be given over 30 minutes, then this end time would actually show 30 minutes and this duration would show 30 minutes, and you can simply sign it. With the IV pushes, all of them will have the same start and end time and a duration of 0 minutes. To change this, you simply go to the end time documentation area and click up on the arrow a couple of times for the time, and then you'll notice that the duration also changes as well. Once you're satisfied with what the duration shows, you simply click sign. It's okay to ignore the infusion volume area. This does not affect your INO. It does not populate into that area. For some medications, this will say 0. Some of them will say the actual mLs of the administration. But it does not affect anything, and you can just simply ignore it. Once you're comfortable with what the settings show, you can click sign, and it will document it. Now the icon will still be above the name of the medication until you refresh the page. We can refresh now, and you'll see the icon disappear. Now, there is no other indication that the stop time has been documented visually on the MAR. You'll just notice that the icon goes away. But if you do want to check on that, you simply right-click inside of the box that holds the name of the medication and go down to the infusion billing option. Once you click that, it will show you what the infusion billing time was documented as, the start time, the end time, and the duration here. If you want to change that, you can go up to the Modify button, and it will open it back up for you to make any alterations that you need to. The durations will also simulate that same time, and you can click Sign again. And you can refresh. And then when you go back inside of Infusion Billing, you will see the new time populate, as well as the option to modify again if you feel the need.